Family and Community Health Sciences educator for Rutgers Cooperative Extension of Cape May County. And joining me today is Jackie Foscalero, who is the FCHS consultant in Cape May County. And she'll be helping me out. If you have any questions, she'll be monitoring the chat throughout the presentation and, muting people that come off of mute, those kind of technical things for us, and helping out as my time goes on. The Lunch and Learn does always start at 12:15, and we will end hopefully promptly at 12:45. And this will give you an opportunity to, go out and grab your lunch if you're on your lunch break, and maybe go for a walk or something like that. And hopefully after today, it'll inspire you to go for a walk. Just to give you a little bit background for those of you who are joining us for the first time, Rutgers Cooperative Extension is part of the Rutgers, New Jersey Agricultural Experiment Station. Rutgers is a land-grant university, meaning it has cooperative extension throughout the state of New Jersey that supports the community with educational information that is scientifically research-based. Rutgers Cooperative Extension is a partnership between the Board of County Commissioners, Rutgers, the State University of New Jersey, and the USDA's National Institute of Food and Agriculture. We have faculty in 21 of the 20, we have staff or faculty in 21 of the 21 New Jersey counties, and we're composed of 3 departments. Those departments include 4-H and Youth Development, Agriculture and Natural Resources, and my department, which is Family and Community Health Sciences, or FCHS. The role of FCHS in cooperative extension is to provide outreach in New Jersey and beyond on topics related to nutrition, chronic disease prevention, food safety, and overall wellness. We have information on our website, lots of different things, fact sheets, and all kinds of extra information, and I'll share those social media handles and website information with you at the end of the presentation. In accordance with federal law and U.S. Department of Agriculture, USDA civil rights regulations and policies, this institution is prohibited from discriminating on the basis of race, color, national origin, sex, age, and disability. All right, so let's get into it. Today, we're going to be talking about physical activity and hopefully ways to incorporate more physical activity into your life, and looking a little bit into excuses as to why we don't exercise or move. So just as a starting point, why, if you are active, put in the chat why you're active, what motivates you to be active and why you do it. Not what you do, but why you do it. Put that in, and we're going to revisit that in a little bit if you go ahead and put that in the chat for me. So as I mentioned briefly here a little bit, we're going to cover today the benefits of physical activity. We're going to talk about determining how active you really are, like giving us a little bit of a gauge there for how active we really are. And we're also going to talk about adding more physical activity into our day. And how we're going to do that is kind of debunk some of those excuses that we all have, I know me included, for not being physically active. All right, so since our society has really become increasingly sedentary or lacking in movement, chronic disease rates have really increased, and so has the rate of obesity, which is a chronic disease. Movement, no matter if it's exercise or physical activity, is important to keep our bodies functioning properly. There's obvious health benefits to moving more at any age. So let's take a minute. I'm just going to go through this quickly. I mean, a lot of us already know about the physical activity benefits that our bodies see, but I just wanted to touch on them just to make everybody aware. And again, maybe give you a little bit of motivation as to why you should be moving. So physical activity and exercise are important, as I said, to prevent disease. Prevention through exercise starts as early as our childhood years, and it continues as we age. So that's not to say that you shouldn't start exercising or it's too late to start exercising. It's always a good time to start exercising or moving. It doesn't matter how old you are, it's going to have benefits. Physical activity done safely and properly helps us to maintain a healthy weight, and that could reduce the incidence of chronic disease like cancer, heart disease, and diabetes, because these are all comorbidities, which means they all kind of go hand in hand. So if you have more physical activity, then you're less likely to have one of these chronic diseases. It also provides us with a sense of well-being. So Dr. Erica Johnson wrote in the Health and Fitness Journal that aerobic exercise was shown to affect participants with a calmer mood when they participated in 20 to 30 minutes of exercise every day. In addition to creating a sense of well-being, moving can help to reduce the incidence of some brain-related degenerative diseases like Alzheimer's disease, and it can also prevent other degenerative brain diseases. Because physical activity shows us, how to maintain a healthy weight, it also helps us to get a better night's sleep. Since exercise has been, excuse me, excuse me. Since exercise has benefits on stress relief and overall well-being, it helps to ease our mind, and that's going to help us to slow down at the end of the day so we can get a good night's sleep. It's also shown to help people that have sleep apnea. Movement and exercise reduces obesity, which is related to sleep apnea. So it can help reduce some of the symptoms of that and make you feel like you're getting a better night's sleep and actually get a better night's sleep. Physical activity can also reduce the incidence of obesity, like I said. So we want to try to move as much as we can. Excuse me, I have a little tickle. So movement recommendations, just as a review, I know some of you have been in some of my presentations before, but in case you're new, the USDA recommends that adults exercise for 150 minutes per week. And that should include 2 additional days of weight-bearing exercise. Children should be active for 60 minutes per day. And it's important that when you consider being active, if you're breaking it apart into little increments, you should give yourself at least 10 minutes of physical activity in one increment. So if you're trying to get 30 minutes a day and you want to break it into 10 increments, you want to do that in 10-minute increments. Also, the 150 minutes is a minimum recommendation. So there is no law that you can't go you can go further than that. So you can certainly do more than 150 minutes per week, but that is the minimum suggested amount. Now that we know the benefits, which I'm sure many of you already realize, of being physically active, let's really talk about how to gauge how much we're sitting during the day. So there's a questionnaire, and I thought it might be helpful to look at how much movements everybody's getting. And the questionnaire that I use to examine this information is called the International Physical Activity Questionnaire. And I'm not going to have you put in there how much you're moving or, add to this, but just use this as a guide, maybe to kind of think about how much you're moving and give you an idea. A lot of times, we think we're moving more than we are, or we think we're more active than what we are, or we're eating healthier than what we are. That's why a lot of times you'll hear people suggest journaling about around your eating habits. It might be good to journal around your physical activity habits. But this is like a guide. It was developed over 20 years ago in Geneva, and it was a measurement to kind of see across different countries how people were moving and to give an idea. So I just brought this out and brought this forward to have you have something to think about, okay? So think about this as I'm talking about it, and really be honest with yourself about how much physical activity you're getting. And don't forget, I asked you to put in the chat why you are being physically active, not how or what you're doing, but why you do it. And I'm going to go back to that in a minute. So if you haven't done that yet, please add to the chat why you are being physically active. So it was, like I said, this was developed over 20 years ago. The questionnaire breaks daily habits down. So for instance, the first area that you can see there on the left is employment. And that section of the questionnaire asks participants if they have a vigorous or moderate activity at their job. So for instance, does your job require you to dig or do heavy construction? If so, that's considered vigorous exercise at work. Or is it maybe, is that for 10 minutes at a time? Or you remember I said we want to do it for 10 minutes at a time. How's that broken apart? And also, if you're not doing that vigorous, are you maybe lifting things that aren't so heavy and moving them for 10 minutes at a time, maybe lifting boxes or something? for more than 10 minutes at a time. That we consider like a moderate if it's not too heavy of an item. So you have the vigorous level of work, of activity at work, and then you have the moderate. And we'll get to the below moderate in a minute. But again, think about what your job involves and how much you're doing that, because we're at work a lot, right, during the day. Then they also try to break that down. They say, don't include walking as part of your job. Like they break that down in another section for that 10 minutes at a time, because some people, you know, if you have a job where you're moving a lot, walking, they break that apart to give you like an extra boost of how much you're moving, right? And then in both of these areas, of vigorous and non-vigorous, the questionnaire follows this through with transportation, house work or house maintenance, recreation, and sport. So they want to know how long you're doing it for, like figure out how long you're doing these things for, how vigorously you're doing it for, moderately or vigorously, and how often you do it throughout the week. So for instance, you know, again, we're not talking about like exercise or physical activity. These are just your daily routine things. So if you're working in the garden and you're, you know, like I'm not real vigorous when I work in the garden, I'm more moderate. So I'm walking around and maybe lifting things here and there, you know, raking, maybe sweeping. That's more moderate compared to my husband, who is maybe, you know, going at a faster pace than mow the lawn, digging bushes out, or, you know, doing things that are a little bit more vigorous. So think about where your level is and try to figure that out, because that really weighs into how much physical activity you're getting overall. You know, do you have a really vigorous work schedule at work, and then you come home and you sit on the sofa for 8 hours and then go to bed? So they're just levels like to think about, because I think, again, like sometimes we don't have a real realization of what that is. And I know I hear a lot of people say during the pandemic here, they're doing a lot less of that activity, especially during the day, the work activities. You know, if you're not getting up and moving to the copier or going to talk to a coworker, you're just sitting in front of the computer, you've gotten a lot less movements going. And then finally, you can see all the way over here on the right-hand side that they are talking about sitting, which is not moving at all. And that's really important too, because you know, I consider myself to be relatively active, but I sit all day long for 8 hours a day, at least at my desk and in front of a computer. So think about how physically active you're being throughout the day, in addition to exercise or physical activity that you're doing on top of that. And, you know, for transportation, it would be, do you drive to the grocery store? Or do you ride your bike to the grocery store? Household activities, again, like how much are you doing there? Are you paying somebody to clean your house, or are you doing it yourself? So, and leisure and physical activity, or leisure and sport, are you sitting on the beach and enjoying the waves, or are you walking along the beach? So think about how much you're doing that, because they could be little clues as to how to add things in throughout the day for you, and they're important. So before we move on to the next step here, I have to set things aside. I just want to look up. We only have 2 people answered in the chat. So somebody said why they moved. They don't want to get heavier, so they want to stay fit. And they know that they need to be active to stay healthy. So thank you for those folks that did respond to the chat. Yeah, a lot of people do it for the physical, you know, well-being, but there's also the benefits of the chronic health well-being overall too. So keep that in mind, you know, for good reason to move and stay active. Sleep, it's another reason. If you're not sleeping at night, that's a good reason to be physically active. All right, so what are some reasons? Let's talk about reasons why you're not moving now. So if you want to put that in the chat, I mean, I'm sure everybody has a really good reason for why they're not moving. And I want to focus in on those right now, so we can talk about why some of those reasons or excuses might be kind of debunked. You know, they seem really valid, but what is a good reason that you're not, or at least the reason you give yourself for not exercising? Think about those. And if you want, you can put it in the chat. If you're not comfortable, that's fine. But there's a lot of reasons, you know, and I'm going to go through them. That's why I'm asking to see if anybody has any of those type of comments. Nope, nobody's putting in why they don't do it. Okay, well, hopefully everybody is physically active And hopefully if you are making excuses or have reasons why you're not being physically active, we're going to cover some of them now. So the Heart Foundation created this list from an article that they put up on their website. And they talked about why people are not physically active. So let's look at this and see if there's any reasons here why you are not physically active, because I've heard, all of these reasons before, and I've used most of these reasons myself. So hopefully by, taking these reasons out or, taking this myth away, it'll give you an idea as to why you should move, and it'll give you a reason to move. So first off, people said they were too tired, costs too much, so it's too expensive. They don't have time. They need motivation. They don't like to exercise alone, so they're lonely when they're exercising. They get bored. They're not able to, so they have some type of physical or age limitation, or something is prohibiting them from doing it, or they're embarrassed. So I really, again, I want to use these reasons to help encourage people to step it up and get, more active and feel more healthy and good about themselves. So let's break them all down and see if we can kind of take some of these apart. So the first one, you're too tired. So this is a really valid reason for not moving, but the reality is that physical activity improves your sleep, as we talked about earlier, and that'll make you able to sleep better, and that'll increase your energy level. So you see where saying, oh, I'm too tired to do that. A lot of times if you just, I always say that the effort is lacing up your shoes and actually getting to the exercise. But if you actually get out there and do it, that really will help you to feel more energized. One specific study done at the University of Georgia found that no matter the participants' group differences, there was an increase in energy in those who exercised. And these folks included folks with chronic disease like cancer, diabetes, and heart disease. So no matter the group across the board, they felt like they really had more energy after they exercised. The author of this study says, we live in a society where people are always looking for the next sport drink, energy bar, or cup of coffee that will get them that extra edge to get through the day. But it may be that lacing up your tennis shoes and getting out and doing some physical activity every morning can provide that spark of energy that you're looking for. So maybe lay off the caffeine and the sports drinks or energy bar and just get out there and move. So if you're feeling too tired to be physically active, try adding that movement in, and you might notice that right away you start feeling more active. So take note of it. If you're active, you might be more tired in the beginning, but you build up to that and you feel better overall. So the next excuse was that it's too expensive. And again, another really valid excuse is that it's expensive. And especially if you're looking at joining a gym or you wish to buy certain equipment. But if you're physical activity and exercise don't really need to be costly. There's ways around that. So if you really want to be a gym member, then do your homework. Make sure that you're comparing facility to facility, one to the other, and seeing which one fits best within your cost barriers, and making sure that what you're getting is what you think you're getting. So sometimes they'll charge extra for classes or certain equipment or things like that at gyms. So make sure that you're an informed consumer and you know what you're getting so that you don't get those extra charges. Also, keep in mind, excuse me, keep in mind too that if the gym closes at 7 o'clock, or 8 o'clock, and you don't get done work till 7 o'clock, then it's probably not going to be a really good cost-effective thing for you to go there. So it could be stressful. So make sure the times are good for you. Also, now some employers are offering gym memberships. So you might want to take a look at where your employer will support it or pay part of it. And likewise with health insurance. I'm sorry. I have a real tickle today. Likewise with health insurance, sometimes they pay a reimbursement or cover it. So you want to check with your healthcare provider to find out if you can get reimbursements for that. And then you can also do something in your own workout space. So it doesn't need to be expensive. You can buy things like, an exercise band to start with, maybe less than $20, and you can work a lot of your body to do that. And then finally, lacing up a good pair of shoes and going for a walk, that doesn't have to cost you anything either. And it's a form of physical activity. There's always ways to do it, cost-saving ways to do it as well. So if you're starting and you want to buy equipment, again, start slow, buy something that's not too expensive, and then kind of build up from there, so that you're not, putting a lot of money out and feeling badly if you don't care for that piece of equipment or something. So build up to that. So try to find ways to get around that expense. The other thing I want to mention about expense is, you want to talk about cost. Living a sedentary lifestyle means a lifestyle with very little movement and more sitting or laying down throughout the day. So to give you an idea of what that sedentary lifestyle that we as Americans lead is costing us, physical inactivity accounts for more than 11% of total healthcare expenditures and are estimated at $117 billion annually. And that's according to the American Health Rankings produced by the United Health Foundation. So, it's costing us a lot of money on the other end, being physically inactive. So when you think about it, like, obviously you personally are not going to be paying that $117 billion that's going into healthcare costs, but it could cost you down the road. So weigh out what the cost could be in copays and seeing doctors down the road, because you might develop a chronic disease from not being physically active. And you want to make sure that you pay, if you're paying it now, again, you're being cost savvy about it and you're looking at what you're paying, but think of it in terms of long-term and what it might save you in the long run, not just in actual physical cost, but in how much you're able to be physically active as you age. So it's an important component of aging is to be physically active and hopefully save you money. So hopefully we debunk that one for you, and you will be more physically active if that was your reason for not being active. So time, again, none of us have the time. It's short for everybody. But have you ever considered how much time you spend on your phone, maybe looking up funny videos of cats or something like that? There's a huge variable in the amount of time that is being spent on cell phones. It depends on where you look. I found between 2 and 7 hours, but because we're research-based information at Rutgers Cooperative Extension, I'm referring to an article that was published in the International Journal of Environmental and Public Health. They did a study in 2016 that examined how often college students that are actually studying exercise science spend on their phone average a day. And it came out to 2.75 hours, which I personally think is pretty low for college students, but hopefully that was correct for this. This group they studied. 2.75 hours was the amount. The study was done by Nikita Pengli et al. And she used this to see if there was a relationship between the lack of movement and how much smartphone use was. So I just bring this up because that even if it's only 2 hours for you a day, if that's 2 hours that you're spending as downtime, why not spend it doing something to be physically active? Because again, it's going to prevent chronic disease, which your phone can't do. It's going to, make you sleep better. It's going to help you to maintain a healthy weight. So there's a lot of advantages to transferring that 2 hours or whatever it is you might spend a day on the phone to being physically active. Another way to find time, if you're driving a parent or a child or a loved one, maybe a neighbor, to the doctors regularly for some type of treatment or whatever, and you're their ride, then maybe instead of sitting in the waiting room, walk around the parking lot. Or same with like sporting events, or, the kids usually, if you go to a sporting event and you're there as the viewer, the parent, there's usually warm-up time. So spend that warm-up time before the game or event walking around the field or the playground, or even, find a fellow parent and do it at practice at night instead of just sitting in your car. So that gives you time on the sidelines to be physically active. The other way that I would suggest if you're short on time is really to try to schedule it, because, we are so scheduled in everything we do. If you make it part of your schedule, it's more likely to be fit into your day, and that might, make it a priority for you. And it should be a priority. It should be a priority, just like bathing or eating healthy or anything else you do. So finding time to get more steps in and move more isn't that hard when you really break down and look at what you're doing throughout the day.
Chris, I just want to let you know there's 5 more minutes.
Okay, thank you very much. So the next thing on the list is not being motivated. So you know, the timing of when you exercise could be a good motivator for you. If you're not a morning person, then try changing it around so that you are motivated. Also find something, somebody said that, you know, they use it to help maintain a healthy weight. I think use that as your motivator. If it's delaying the sign of aging, maybe that's a good motivator for you. But when you're looking at breaking it down and trying to find motivation, try to look at the SMART way of doing it. So specific, measured, attainable, realistic, and timely. You know, you want to make sure if you're trying to motivate yourself, don't go after that mountain and the lady's heading towards, but start out with the path a couple days a week and make it specific, you know what you're going to do. Measure it, maybe measure it by time or measure it by length or measure it by how you feel. You know, that's another good measurement. Make it attainable. Don't say, I'm going to walk for 2 days and then I'm going to climb that mountain. Be realistic, because then you're just going to be sore and uncomfortable and you might not make your goal. So then again, you might not be motivated. Be realistic. Again, you don't want to climb the mountain before you walk the path for a while. And then also be timely. So set it within a time frame that is reasonable for you. Other people say that they're embarrassed. And you want to make sure that you're thinking in terms of Dr. Carol Dweck. She came up with a 30-year investigation on how our fixed mindset works versus how our growth mindset works. So our fixed mindset says that, you know, an achievement is possible or is not possible. And so if you're embarrassed, you might be saying that that mindset is, you know, not possible for you. And that could be limiting for you. So think about it in terms of growth. So instead of thinking, you know, I can't do this, think about it in terms of I did a little bit today and I'll do a little bit tomorrow. And that might help a little bit with your mindset as well as your embarrassment. And I'm going to tell you that most people, I've worked at gyms now for almost 25 years. And a lot of people don't know what they're doing. If you're embarrassed, find somebody to do stuff with. Take it a little less serious, but make sure you're safe and realize that, you know, you can do things on your own to work up to not be embarrassed. And then maybe go to the gym if that's where you're embarrassed. But there's always ways that you can work around this by trying to like frame your mindset to be like goal oriented, growth oriented versus, you know, what you can't do in your mindset. The physical limitations, again, this is a real, physical and mental limitations are a real thing and you should not be dismissed. But there's plenty of things out there that you can try to do, you know, like whether it's water exercises, if you can't bear weight on your knees and hips, there's group exercises for that. Maybe look at, you know, trying to do yoga or sitting aerobics, but whatever your limitations are, try to measure them. And you don't have to finish the workout, but do a little bit at a time. Again, if you get out of breath from walking too much, try building up to that at little increments during the day. So, you know, try to tell yourself you can do it. Keep that growth mindset that you can do a little bit at a time within the parameters that your doctor says is safe for you, but make sure that the limitation isn't what's holding you back. Boredom. So an article published in the U.S. National Library of Medicine, National Health Institute describes boredom as having both negative and positive effects on workers. And that might apply also to your workout, right? So if you get bored, you might not want to do it as much. But we do find that combating boredom can be changing things up. You know, it might be chasing the grandkids or the kids around the playground, or it might be, there's apps now out there. And this is one of the things I learned from being involved with one of these things is there's a zombie run. So one of the apps you can get is for the zombie run. So you get the zombie run on your app and it has your regular music in there and then it plays. Then all of a sudden it'll tell you zombies approaching. And as you're running, you have to outrun the zombies. So it's just something different. There's plenty of apps out there that can keep you motivated. You can change your scenery. Try, if you're inside all the time, try going outside to nature and trying to find ways there to be more physically active. Finally, being lonely. If you're same thing, if you're a social person, then being lonely could be a problem for you. Try going to if you go to the gym at the same time, see if there's somebody there that, you know, even if you have a conversation with them once in a while to say hello, you don't want to interrupt them or have yours interrupted, but your workout interrupted. But try having some time with them, you know, making a friend at the gym. Also trying to find, again, we're zoomed in. Everything we do now is on Zoom and apps and FaceTime. Maybe bring the person along if you're going for a walk that lives far away, and it'll give you that social interaction and time to interact. Also, if you see somebody that's on social media at the same time as you are, then maybe you want to reach out to them and, say, hey, we're both on Facebook at the same time every night. How about we go for a walk at that time? So try doing that. And then there's actually apps where you can go and find people that are wanting to work out in your area that you can connect with that way too. So there's ways around that as well. So I just want to put this up. If you hold up your phone, it is excuse me, it's the evaluation for today. It's very helpful for me to know how things went today and what you'd like to see in the content. And then I'm also releasing the poll, which is just 3 questions. If you could just take a minute to answer the questions in the poll before we wrap up. And then, not clicking. Oh, here we go. Here's a little quote from Nelson Mandela, hopefully motivate you a little bit more. Exercise is key not only to physical health, but to peace of mind. So if you're looking for that motivation and you can't find it, hopefully you can find it by thinking about your peace of mind and how it makes you feel. So again, it was a lot of material here. I'm gonna, if anybody wants to stay on and you have questions you want to put in the chat, that's great. But if you need to go for lunch, I totally understand that. And I appreciate you joining us. It's important when you're trying to find ways to create movement in your life, you want to make sure that you make a plan, make it fun, do something you love. If it's something you dread, you're not going to do it. And it's not going to help you add physical activity. Always try to note how you feel, like take the positives, like I might be a little sore, but I have more energy. So try to take those positives and find out how they're helping you. And look at how much you're sitting versus moving and find ways to do that. If you're sitting a lot at work, like I do, then get up and, walk around a little bit and get some movement throughout your day so that you have that opportunity to be a little bit more physically active. As promised, here's my contact information. So if anybody needs to reach out to me, I'm always glad to hear from you. And then I also have my resources. And this was, I used the Go slides for these presentations. So let me go back here a second. Let me see if there's anything in the chat. Nope. All right. So go be active, everybody. It's hot out there today, so take caution, drink a lot of water, but hopefully you found ways to debunk some of those excuses that we all have for being physically active. And I hope to see you soon for another presentation. Thank you.